I'm sure you've heard complaints, or maybe had them yourself, about our city's 911 hold times or slow ambulance response. But a few years ago, City Hall created the Community Safety Division to try and fix Portland's emergency response system. The goal is that by mid 2024, the financial operations of Portland's four public safety bureaus will live under one roof at the Community Safety Division. In this way, our city can develop a more holistic approach to Portland's community safety. So today on CityCast Portland, we're talking with Mike Myers, our previous fire chief and the now transition director of the Community Safety Division. He's going to walk us through what's working, what's not, and what the future of emergency response in Portland looks like. It's Tuesday, August 1st. I'm Claudia Meza, and this is what Portland's talking about. Before we jump in, I just need to know, how many Austin Powers or Halloween jokes have you gotten on the daily? Has it changed at all?
It hasn't changed, and you'd think at some point it would, just out of generational differences. But I probably get a Halloween comment or a Mike Myers comment from Austin Powers probably once a week to this day.
That must be so frustrating.
It's funny.
Do you have any cool comebacks yet?
No, not really. Not yet. So I'm still listening.
Listeners, if you have any cool comebacks for Mike Myers, please send us them, and we'll make sure he gets them. So, because you're helping counsel the main four public safety and emergency response agencies, you kind of have a bird's eye view of all the issues they're currently facing. So one of the biggest complaints Portlanders have with emergency response are the wait times.
Yep.
What are you seeing as the main issues causing these backups?
Well, wait times, it's a very complex issue, even nationally. So it's not just here in Portland. And wait time issues, they can originate from multiple points of origin. And typically, they're more than one. It's not just one issue that's driving wait times, whether the wait times, and wait times should be defined. There are wait times in call taking when the caller calls 911. In response, when an ambulance and a fire truck arrives on the scene, sometimes there are wait times for transport, depending on the number of ambulances that are available in a system, whether they're in service or out of service. There are wait times that we're probably all familiar with in the hospital systems across the country, and certainly here in Portland as well. When you arrive at the hospital, how fast are you offloaded from the gurney from an ambulance and then into a hospital bed? And so those wait times are all connected, typically, and there are multiple causes for those wait times. So I would assume, Claudia, we can start with wait times in call processing at the 911 center. And, I come from out of state, out of market. I arrived here in like 2016, having seen it done differently in a couple of different cities. And so a couple things that I recognized here in Portland that are different here than they are in other cities is most cities have already navigated through why to call 911, both for emergency and non-emergency. And here in Portland, we only had one number for, if you had a problem, you needed a police officer or a firefighter or a paramedic, you called 911 for everything.
Yeah.
And that bogs the system down when you're calling 911, when really it's a non-emergency call, which we do require a non-emergency number, like 311. Most systems, most major cities across the United States have long-standing non-emergency 311 call-in numbers.
Yeah.
Portland didn't. We are just rolling ours out, Claudia, like right now.
And that's funny you mentioned that, because I remember I grew up in LA as a child, and you were just told if you call 911 for funsies, it's $50. Your parents get fined. And I don't know if we even have that here now. They're just like, this wasn't an emergency. We're fining you, But that's how serious it was in larger cities, because they don't want this. I want to hear about all the other wait times, but I just wanted to bring up a point that the 911 dispatchers and that bureau, like BOIC, has had a huge win because Steven Ziprich won the North America's 911 Operator of the Year, which also includes Canada, which to me, I was just like, take that. But he actually said something very similar, just connecting the dots here. His first response was just like, we've grown as a city so much. And the infrastructure pretty much hasn't kept up with that. And that would make a lot of sense if we get a bunch of new people. We only have one number. Everyone's calling it.
Yep.
Now you're waiting 15 to 20 minutes to speak to someone.
That's right, and we can't blame this all on
Hmm.
the fact that we didn't have 311. But I do think over time, over the next this generation here in Portland, we have to start navigating as a residents to a 311 type system. We have to understand what's non-emergency and what's emergency, and understand that and make choices as residents when we call. Staffing is also an issue, and I think
Hmm.
Director Bob Causey has done an amazing job. Bob started shortly after I did in the 911 center. I think he came in at 2017, 2018, and he just did a fantastic job kind of converting that 911 center over to a new system to process calls, but also working on their staffing, which during the COVID outbreak, I think you heard nationally, almost every sector had a hard time staffing for whatever it was. And when that impacts first responder um, divisions like fire departments or police departments or 911 center or our nurses, we really feel it here when we have an emergency. It's okay when you go to your favorite restaurant and they may be down a few staff. That's one thing. But when you're needing to access the emergency medical system and they're down on staff as well, that's when it can be life threatening.
Hmm. And there was a report that came out a few months ago where someone died before medical responders could come get him. Believe he died of a gunshot wound. It was a hit and run. I'm sorry. It was a hit and run, and he waited about 30 minutes for the
Mm-hmm.
ambulance to come through. Do you remember hearing about that?
I do. I recall that incident, and I recall the media attention around that. And again, I think when we talk about wait times, you know, that incident cannot solely rest on this issue we're talking about right now. Wait times, again, are across the board. And a lot of it is driven by staffing. So when you have a shortage and you're required to have two paramedics on that ambulance every day, and let's say you might have north of 25 ambulances on shift every day, if you can't staff, if you can't get enough paramedics through the system, through the certification system, get them trained, onboarded, and on an ambulance, you're only going to be able to run enough ambulances that you can staff. You may be, south of 20 that day. You may only have, 17, 18 ambulances on that day when you really needed, 27 on that day. And when there's that kind of an issue, the same call volumes coming in with less ambulances to respond to it, at some point you're going to not have an ambulance available.
So, what are the most urgent priorities in addressing the response times right now?
So there are so many with response times. And again, the problems that we're seeing in public safety, Claudia, there is no one, if you do this one thing, it solves the problem.
Hmm.
It takes they're all complex issues, and there are multiple things we have to do to solve one problem. So response times start and originate from a resident having a problem and being able to access the 911 call, because the response time in their head is I have a problem right now.
Hmm.
How soon will somebody be at my door? That's the response time in a resident's mind.
Right.
And so that all starts with the ability to access the 911 center. And so people can access it, right? We all have mobile phones. That's not a problem. And I think Director Causey from BOIC would say the same thing. We still need to improve on call answering times in the Bureau of Emergency Communications. So I know where Bob wants to go, Director Causey wants to get to. In systems that I've been in, when you call as a resident to 911, there is no wait time. It rings into the dispatcher's ear, the call taker's
Hmm.
ear, and they immediately say, please fire medical.
Hmm.
And we start the conversation. People are waiting here for 30 seconds, 45 seconds. And then if you listen to some stories, much longer,
Hmm.
especially if it's non-emergency, they're hanging up. That wait time is dependent on many different things. We talked about a couple of them already. Staffing is a constant concern, but I think Director Causey has a good plan and has been building up staffing, and he has a large number of individuals in training. I think things are turning the corner around staffing, and they have a different call processing. They have multiple different call processing tools they're using.
Yeah. I asked about the most urgent priorities in addressing the response times, and what we've talked about are just two things that we've already kind of hit at the top, which
Yep.
was a volume of calls and getting that 311 up and running,
Yep.
and then actually getting some staff for understaffed areas. Is there anything else that your team has honed in on?
Sure. Let's continue to progress kind of through the matrix here. So as you know, as we get the call dispatched, once it gets out of the dispatch center, the number one identifier on the ability to meet a response time is the availability of a unit to be there and
Hmm.
be in the area. Like the fire department sends the closest unit by satellite. So it's not just your fires. If something happens to you in the air in Portland, it's the a fire station that maybe down the road might not be the one responding to you. If an engine company from a different fire station is closer because they're driving through that part of town, the
Mm.
satellite will pick them up and send them. Like that's a step that the fire department took in the probably 2020 2019 to change the way they did that to have better response times. After that, the next thing that is impactful are hospital wait times. And the reason that's important in the whole conversation around response times and why we all have to be partners in this is when a ambulance. So when we go to a call, we have a fire truck there with a paramedic on it and a American Medical Response ambulance with two paramedics on it. Once they get to the hospital, the time that unit is still out of service. So even if a fire department paramedic gets in the back of an ambulance to work with the team on the patient to the hospital, they're waiting in the hallway at the hospital to offload. Those hospital wait times are extremely important
Hmm.
because while they're waiting in the hallway, they're out of service. So we talked about, we struggle to get enough ambulances on the street anyway because of the paramedic shortage,
Right,
and
right.
they're in the hospital waiting to offload, sometimes longer than we would like, and I'm sure longer than the hospital would like. Um, that keeps that ambulance out of service, so even less ambulances available, and then we have longer response times again. So you can see how every one of these areas, Claudia, needs work. And again, this is not just Portland. Every city faces this convoluted issue on staffing. So even nurse staffing in an emergency room matters on response times in the street,
Hmm.
right? The ability when we get to the hospital to have enough staff to help us offload and get things going can backlog into the street. So it's that whole continuum of care.
Okay, well, let's take a quick break here, and when we come back, let's talk about the Portland Police Bureau. I noticed that one emergency response team that was left out were the police, and I'm wondering if you are able to speak about that, because a lot of people have been speculating. This is of course speculation, Mike, which I don't expect you to really go in on, but they've been accused by the public of quiet quitting, which is it's a big allegation. Do you know what's going on right now in the police department to increase their or decrease their response times?
Well, I can, I don't want to speak for the police chief, but I can tell you that it's not quiet quitting. Like I know that, and I think that when everything that has gone on in the social environment and the fabric of our lives, all of us here as a community, including officers and all of us that live here, over the last 5 years, I can see how people might get to that point. But I can tell you, I sit through a lot of police briefings listening to staffing. I do manage their budget, and so I do, I pay attention to the struggles that they have. And this is not quiet quitting. What the police bureau is experiencing is a grave um, issue around staffing and the ability to catch back up, and it is a struggle. They do have a tremendous amount of vacancies. I was in a meeting the other day with one of the deputy chiefs, and he was explaining to us we have 800 sworn officers. 800. That sounds like a lot, but when you start taking out where these officers are signed and actually who's on patrol, there was a discussion in the meeting that back in the day, 5 years ago, they would have said, any precinct cannot go below 130 officers. Like you cannot anything below that. They cannot functionally do the work that they're supposed to do. They're way below 100 officers every day now. They're that low, Claudia. So when I look at their response volume coming into police every day, I would say on the majority of the time, there are always calls waiting. They're all just going from call to call to call to call. And if there's something major, and as you know, there always is, there's always, a shooting, a bad traffic accident, some kind of robbery in progress that they are busy going to. It takes more than one officer on those types of calls.
Mm-hmm.
But there is room. I think we would all agree, and I certainly have been pushing this. I think there is room for improvement. However, the police bureau and the fire bureau tend to send everything they've got to all types of calls.
Yes, I've noticed that.
Right.
Yeah.
And so,
Mm-hmm.
we've been really vocal about, can we really look at all of the calls? And are there calls that, so from a policing standpoint, are there calls that don't require an armed officer? Like, do they really need to send an armed officer in this call? And if the answer is no, or maybe it's a yes, but can we like work on this so the officer doesn't need to go, so they can focus on the highest priority calls, and maybe give those lower priority calls, find somebody else to go on that call.
Yeah. You just mentioned the possibility of sending unarmed officers, basically triaging what is this emergency entail and who needs to go there. And part of your division is to help support alternative safety response models
Right.
that would alleviate that high volume of calls to 911 and other first responders. One of these teams has been getting a lot of attention lately, the Portland Street Response.
Mm-hmm.
Are you able to speak on what the city is planning to do with that model? Data seem to point that it was working, but there's numerous reports that the city is not fully supporting or expanding the program.
What I can say, Claudia, is that Portland Street Response remains under the work of the fire chief, so it's in the fire bureau. It does not sit in my division, the community safety division. So I do not supervise that group, and I don't drive their policy or the work that they do. What I've heard, I can only tell you what I've heard, and again, I don't want to speak for Chief Gillespie or Commissioner Gonzalez's staff. They are driving where Portland Street Response is and where they will go. What I have heard, though, Claudia, openly said in meetings, so I feel comfortable sharing it here, is that they are very supportive of Portland Street Response. They want it to be successful. They want to figure out a way to make it sustainable, so it needs financially sustainable. And we do need to figure out, all of us, on how it can operate best in Portland going forward. One of the issues that Portland Street Response faced, and this was by no means in any way their fault, the inability in this country to help an individual that's addicted to drugs or has a very high level mental health issue that they're facing on the street. Our inability of a society to provide a place for them to be taken to is resulting in what we're seeing out here. You can run Portland Street Response all day, and you can run police officers all day. I can find non-police approaches to responding to people in crises. Claudia, we will figure that part out. That is not that hard. Where do we take these people, Claudia?
Mm-hmm.
Where can they get help? Because if all our answer is, Claudia, we're going to go see them on the street, de-escalate, and leave them there, I don't know of a more inhumane thing that we can do. And it's not just our city, Claudia, it's across the country in our major cities.
Well, it was a federal mandate that passed down through Reaganism, but that's another conversation altogether.
But it's an important one. I mean,
Yeah.
what do? We need legislative changes. We need mental health facilities. We need facilities that work. We need facilities that we can drop people off at, and they need to be open, staffed, and they need to be open and staffed today. Now, with that said, we're years away from that. I mean, that funding doesn't even exist. Those brick and mortar places have not been identified. Staffing has not been hired. We're a long ways away from that. But our voices matter. When really bad things are happening, it starts with us demanding change. And it really needs to be all the way up to the federal level. There's nothing the mayor can do. This isn't, from a public health standpoint, I don't think there's anything that the mayor could not open a facility tomorrow. It doesn't have that power, but his voice does, and he's serious about this. We need change in this country, and we're seeing it right here in Portland for sure.
Right. As we look into the future of emergency response in our city, I'm hearing a few multi-pronged approach of getting more staffing, of getting facilities that we can actually send people who are struggling with mental health issues or drug addiction. It's just hard to see our response systems flounder until we get there. What do you think needs to change in order to get there? Like, what else is being done?
Well, there are some interim steps that have to be taken. I mean, I think hope is not a method. Hoping this will get fixed is not a method. That's not an answer. Avoiding it is not appropriate. And so and just waiting for something to change is inappropriate. So we have to do something. One of the solutions, and this is, I don't know if it's controversial. It's certainly arguable. We have to think of multiple solutions. One of the solutions is this: we just opened this temporary alternative shelter site over in the Clinton Triangle, and Claudia, the idea behind it was open a location where people that a very low barrier, so people that were living in the street, that were vulnerable, that were preyed upon, that have drug addiction issues, that are untreated, give them a place to get out of that environment where they can a lot of them don't want to go to brick and mortar structures. They don't want to go to congregate settings like are inside of a warehouse. They don't want to go to a different kind of, different shelter. They want to live outside. They have certain things they want, like provide that for them so they'll come, receive them in a way that they can accept, allow the low barrier entry, and while they're there and they're safe from being preyed upon, start providing those services on site so they can start to understand their addiction, possibly get past it. If they have other needs, like some of them need IDs, some of them have, past felonies that need to be expunged. I mean, there's all kinds of things that we can help them with in these settings to get them set up so we can move them from a tent on the street into the site if they would like to come. These are invitations. Prep them and get them ready for alternative or temporary supportive housing from there.
So what you're saying is that on July 25th, the
Yes.
Clinton Triangle opened up. This is the same facility that Mayor Wheeler has been pushing for almost a year now, and it's finally opening. And so what I'm hearing is the future of emergency response in our city looks like these types of facilities that are being opened.
It quite possibly could. I mean, I think Portland is an innovative city. We are leaders in many different areas. We also have our extreme challenges, as you know, and we're not leaders in some areas, that's for sure. But this area, I believe that we will be. Other major cities across the West are trying different things. I believe that this is going to be a showcased opportunity, a best practice. We get to see. We haven't seen outcomes yet, so we need to see that. We need to hear what the experience is for people that are living and working there before we can tout it too much. But it's open. We believe it's the right step. Again, we started off this conversation saying doing nothing is not the answer. We have to do something.
Right. And we're hoping that all this somehow then alleviates response times. I'm just trying to bring it right around, Mike.
Yeah, we can. I can help you with that. So I think if we're looking at still response times, going back and tying it in, and I think we started that conversation also saying no one thing will fix our response time. You have to look at every item that's causing response time, wait times, and response time delays, and start fixing each one of them. If it's response to houselessness, which is a certain percentage of call volume, if we can realign that to a different location, that's the success. What's the next thing? And so it is about appropriate staffing in the police bureau, appropriate staffing in the emergency rooms, appropriate staffing for our private ambulance companies, appropriate staffing at the 911 center, a new way we're going to triage calls at the 911 center, opening of a 311 full-time, getting the temporary alternative shelter site open, finding alternative ways that we can send people to calls to free police officers up on certain calls. It's all of these things, Claudia, that we are working on simultaneously that ultimately, we hope will start to fix some of those delays in response times.
Oh, Mike, thank you so much for walking all of us through that. We really appreciate all the hard work you're doing and also your time today. Thank you.
Well, thanks for having me. Appreciate it. Important topic. Portland's a beautiful city, and it still is, and it's been better, and we can get back to it. I really believe it.
And now for your microdose of news. Car thefts in Portland are down. In fact, they're at their lowest point in 2 years. And the new Multnomah County Auto Theft Task Force also announced its first high-profile arrest this past weekend. Investigators arrested a 24-year-old Portland man they say has been involved in multiple car thefts over several months. And an update on a story we talked about on the show last week. You might remember that in our conversation with sex educator and writer Elle Stanger, we mentioned that the Oregon legislature allocated $600,000 to study the effects of decriminalizing sex work. Governor Kotek is now saying she might veto that spending. Her office says the funding should come from the private sector. Not sure which private sector specifically, but Governor Kotek will announce her final decision August 4th. For even more local news and events, sign up for our daily newsletter, Hey Portland. We'll throw a link in the show notes. That's all for today here on CityCast Portland. Thank you for listening. If you want to support the show, please share, subscribe, and review. We'll be back tomorrow morning with more from around the city. Until then, see you at Slim's.